Okay, there we go. So as I said, I'm Dr. Matthew Wappett, the director of the Institute for Disability Research Policy and Practice. I'm also joined today by Curt Phillips and Meghan Boyd, who I'll let them introduce themselves here in just a second, but we're going to be talking about early intervention here in Utah and the importance of investing in early intervention services. So Curt, why don't I turn it over to you for a second if you want to give everyone a short intro?
You bet. My name is Curt Phillips. I am the director of the Service Division at Utah State University's Institute for Disability Research Policy and Practice. We do oversee a couple of early intervention Part C programs here in northern Utah and over in the southeast part of Utah near Price and Moab. I've been a provider of early intervention services for almost 25 years, as well as have been doing administrative work over the last 4 or 5 years.
Perfect. Thank you, Curt. And then Meghan Boyd.
Hi, I run the DDI Vantage Early Intervention Program. I've been doing that for about I've been with DDI for 16 years. I've been the program coordinator for about 8 years now. I'm a special educator by trade. And I have also taught. So I've been in the special education field for about 23 years. So before this, I taught. DDI Vantage has 4 offices for EI. We have 1 in Duchesne County, 1 in Tooele County, and 2 here in Salt Lake Valley.
Perfect. Thank you, Meghan, and we're glad to have you and Curt on. We are going to have a conversation with Curt and Meghan later on in this presentation, where they're going to share some of their experiences working in EI and some of the issues that we're currently facing. But before we do that, I'm going to give you a quick background. And looking at some of the names here, I know that some of you are very familiar with early intervention. And I should state up front in terms of context, the reason for focusing on this is that over the past 5-6 years, there hasn't been a significant investment in early intervention services. And there is not a specific proposal this legislative session to increase funding for early intervention services. And yet our early intervention services here in Utah are really struggling, and our intent is to raise awareness of the importance of early intervention and the need for the state to invest more resources in shoring up that program. So what we're going to do here is talk through a quick background on the importance of IDEA Part C early intervention programs and the impact that they have on children and families. We're going to talk about some of the current issues here in Utah around Part C early intervention programs. And then hopefully by the end, you'll understand the importance and the need to advocate for increased funding and legislative support for Utah EI programs. So that's kind of what we're hoping to cover in this session. And I'm sure for some of you, this is going to be a review. And I should state right up front that I am not an early interventionist. Although my PhD is in special education, I have primarily worked in the K-12 system and not in the Part C system. And yet, since working here at the Institute since 2017, I've become intimately familiar with our up to 3 and Southeast early intervention programs and the important work that they do. And so you can kind of see me as an impartial advocate, as it were, for these programs. So Part C really starts with a vision. And so early intervention, at its very core, imagines a world where every child, regardless of their abilities, has the opportunity to reach their full potential. That's the intent of Part C. So when we talk about Part C and early intervention, there's a lot of details and policies and regulations, but really at its very core, the intent of early intervention is to provide children the supports that they need to reach their full potential. Now, early intervention is a relatively recent phenomenon or program. It started in 1986. So the Individuals with Disabilities Education Act was originally passed in 1975, which provided access for students with disabilities into public schools. During the reauthorization of IDEA in 1986, Congress recognized that there were benefits to addressing the developmental delays or disabilities in young children prior to kindergarten. And so in 86, Congress amended IDEA to include Part C. It was actually originally Part H, and then it became Part C, which really provides a whole host of early intervention services and funding for states to help address the needs of infants and toddlers from 0 to 3 and their families. So, and Part C, more so than Part B, which is special education, gives states a lot of flexibility and latitude in how and where they set up their Part C services. So when you look at early intervention in one state, although there's maybe parallels, it may look very different than how it looks in another state. For example, here in Utah, our Part C early intervention services are run through the Baby Watch Early Intervention Program, which is housed in the Department of Health and Human Services. In other states, Part C early intervention may be in their Department of Education. And in other states, it actually falls under their Department of Human Services or their Department of Health, depending upon how it's set up. And they may have different funding structures. So again, you've seen one Part C program, you've seen one Part C program, but it's important to note that here in Utah, they're run through the Department of Health and Human Services under the auspices of Baby Watch. Now, when we look at how early intervention is defined in IDEA, the language is really important, I think. So in the actual policy in IDEA, it says Congress finds that there is an urgent and substantial need, number one, to enhance the development of infants and toddlers with disabilities to minimize their potential for developmental delay and to recognize the significant brain development that occurs during the child's first 3 years of life. Number two is to reduce the educational costs to our society, including our nation's schools, by minimizing the need for special ed and related services. Number three, to maximize the potential for individuals with disabilities to live independently in society. 4, to enhance the capacity of families to meet the special needs of their infants and toddlers with disabilities. And then 5, to enhance the capacity of state and local agencies and service providers to identify, evaluate, and meet the needs of all children, particularly minority, low-income, inner-city, and rural children, and infants and toddlers in foster care. Now, when you look at that vision, you go back to what I said at the very beginning, although there is a big focus here on addressing the needs of the individual child, you'll notice that the intent of Part C is not just to help the individual child. It's to help our communities. It's to help our schools. It's to help our families. It's to help providers and local agencies so that they can do a better job at supporting these at-risk, vulnerable kids within our systems. And as we walk through the data, you will see that the impact of Part C is incredible, and it does reduce educational costs, and it does reduce costs for adult services when it's implemented correctly. Now, so how Part C really works, it's very much like special education. Within Part C, Congress provides the state with a little bit of funding. And with that funding, the state is supposed to develop and implement a statewide comprehensive coordinated system that provides early intervention services. Number 2, it's supposed to coordinate payment for early intervention services using federal, state, local, and private sources, including public and private insurance coverage. And again, this is one place where there is tremendous differences between states. The way that one state funds early intervention may be very different from the way that another state does it. Some states allow billing private insurance. Other states don't. Some states have more state investment, more local investment. Other states have less. And so there's significant variability in how this payment works. And yet the federal government says, we're going to pay part of this, but you have to figure out how to cover the rest. So the other thing that this funding does is it enhances states' capacity to provide those early intervention services. And then number 4 is this funding is intended to encourage states to expand opportunities for children under 3 to get the services and supports they need, right, to develop appropriately. And so Part C is really, you can kind of view it as a little grant from the federal government that says, here, we'll incentivize you to do this, but it's important for the state and the local system to also invest resources in order to create a comprehensive early intervention program. Now, the philosophy of Part C early intervention is a little bit different than what we'd see in other programs, because we're addressing the needs of these kids so early on that in some cases we can actually address that developmental delay so that when that child turns 3 or goes into the public school, they don't have that delay anymore. And so the philosophy of Part C intervention is really to look at these infants and young children as whole persons whose needs must be met by interdisciplinary services that cut across programs, providers, disciplines, right? Really looking at the whole child. As part of that, it's really important that the family is involved. In fact, that the very core of Part C is this understanding that children's development is very much tied to that family environment and the context. Now, number 3, when we think about this philosophy, number 3, early intervention is most effective when parents are respected and empowered as consumers and team members who collaborate with the early intervention professionals. I think a great example of this, and I am a family who benefited from early intervention services. When my middle daughter was born, she decided that she wasn't going to speak. And by the time she turned 3 years old, she was almost 3, she was 2.5, and she wasn't speaking. All she did was grunt and point at things. And we realized that, whatever we were doing was not working. And so we contacted our early intervention program. We lived in Alaska at this point in time. The early intervention program brought out an evaluator, brought out a speech language pathologist, brought out an occupational therapist. They sat down, they evaluated my daughter. They worked with me and my partner on how to support her. And by the time my daughter was ready to enter kindergarten, she was actually speaking a little bit, not a lot, but a little bit. But the big thing is these providers didn't spend days and days with my daughter. These providers came out, they spent a couple of days with our daughter and with me and my partner, and taught us how we could support her and really empowered us so that we could work with our daughter more effectively. And as a result, today, she's a college student, she's thriving, she's doing great. And in fact, as my family will tell you, she probably talks more than she should. But the impact was really, really important. And, as I look back on it, I'm like, what was the most important thing? Well, the most important thing was that they viewed me and my partner as collaborators in this process and really helped train us in the skills that we needed to help our daughter. And I think that's a big part of it, is that really that collaborative element in bringing the family in, the community in, other providers in, and really looking across the system in how we address the whole needs, the whole person of these children who are at risk for developmental delay or disabilities. Now, one thing we've noticed as we've started advocating for Part C early intervention services this year is that a lot of times people don't understand what they are. And so there are a lot of other programs that are focused on young children here in the state and building capacities within families, and yet they are distinct and different from Part C early intervention. So it's important to note that Part C early intervention services are not home visiting programs, although they could certainly collaborate with the home visiting program. They're not TANF funded programs. And if you don't know what TANF is Temporary Assistance for Needy Families. It's a federal program for people who are at risk for poverty, homelessness, things like that. And there are aspects of that support early intervention, but TANF is not an early intervention program. Head Start, again, a great program that helps address early development, but it is not Part C early intervention. Preschool, and again, there's lots of other early childhood programs out there, but they are not Part C early intervention. And I think that's really important when we talk about this, is to make it very clear. And you'll notice that's why I'm saying Part C, early intervention. I'm not just saying early intervention, because early intervention is a big concept, but Part C, early intervention, is very, very specific to what's defined under the Individuals with Disabilities Education Act. And it is very specific to meeting the needs of children with disabilities and developmental delays and their families. So the basic structure, and I know many of you are providers here and you're going to be rolling over in your graves with how simple I've made this. And yet when we try to communicate what Part C early intervention programs do, kind of boiled it down here. I think the big thing is that Part C early intervention programs are a no reject program. If a child is referred, right, through the Child Find program by a primary care physician, by a social worker, right, Part C early intervention providers have to see that child. You can't say, no, we're too busy. No, we're going to put them on a wait list. No, we can't. We're overwhelmed. We don't have funding. You have to see them. And so it's a no reject program, which means that all eligible children have to receive an evidence-based assessment and intervention within 90 days of being identified. And from that assessment, providers work with the family to create an individualized family support plan, which is kind of the Part C equivalent of an IEP, which is what a child with a disability would have in public education. And then the Part C early intervention providers work with the child and the family to implement that IFSP. And then the other big aspect is some of these providers will work with these children all the way up until they're ready to transition into school. The other aspect for Part C early intervention is really helping these families and children transition out of Part C and into the public school system, into kindergarten, first grade, depending upon the way that the local school system is set up. But really, at its very core, that's what it is. And it's really important to note that, again, this isn't something like the DSPD waitlist where, oh, we only have this much money, we only have these many slots, we can't serve these kids. Every single child who is referred has to be seen by early intervention. So what is the impact of these programs? When they're implemented correctly, it's incredible the impact that they have. Early intervention over the past 30 years has been shown to enhance social emotional skills. It promotes school readiness. It strengthens family relationships, and it really helps a child be more successful as they develop into adulthood. Now, there are some really important dangers that we've come to understand, especially over the past 20 years, related to the home environment and community environment and the dangers that that places on children. In fact, there's a high correlation between poverty and developmental delays and disability. And a big part of that comes from this notion of persistent toxic stress. So if a child is born in a stressful situation, a home where there is income insecurity or housing insecurity or food insecurity or abuse, neglect, even severe maternal depression, all of those things have an impact on the developing brain. And we find that those simple environmental factors can lead to lifelong problems in learning, behavior, and physical and mental health. And so it's really, really important that when we identify these kids who are at risk for these delays or disability, that we get in there and that we address those needs as soon as possible. The one that I wanted to point out, because I think it's important to note Utah's ranking here, is there's a high correlation between maternal depression and family mental health and the development of a child. And yet when we look at the most recent data, Utah ranks 50th out of 50 states for mothers who report poor mental health. That means we have more mothers here in Utah than any other state in the union who say they have poor mental health. And the same is true for parents of children under age 3 who report they're not coping well. Again, a direct mental health measure. We are very last in the United States for these families of children under 3 in managing their mental health. And that fact means that that family mental health, that maternal mental health, is reflecting on the child and is having direct impacts on their development and their success. And yet research has consistently demonstrated that early intervention can address these issues. It can lead to improved cognitive function, improved language function, improved motor development, can reduce the need for special education or more specialized services and adult services later in life. In fact, the Rand Corporation, which most of you know is a defense contractor, but does a lot of economic work as well, they've done multiple economic analyses that show that early intervention can save states millions of dollars every year. In fact, the Rand Corporation found that for every $1 invested in early intervention, the return to states is $1.7 to $17 for every $1 for each child who receives early intervention services. And that adds up when you look at the thousands of kids who are served in early intervention every year. So, and again, all of our systems are taxed to their limit. All of our systems, DSPD is maxed out. Special education is maxed out. They don't have capacity. And if we can reach these kids earlier, what we found is that 1/3 of the infants and toddlers who receive early intervention services don't have a qualifying disability by the time they're ready to go into school. In fact, in most cases, unless I saw the data, I wouldn't believe that. Because a lot of times we think of disability as something that's concrete and non-fungible. And yet the brain is so plastic and the effectiveness of early intervention is so dramatic that we can get in and we can get 1 out of 3 kids to get caught up with their peers so that they can go into school and remain in the regular classroom and benefit from from going to school with their typically developing peers. Now, Utah, what about Utah specifically? So that's kind of looking at early intervention from a very large national lens. Utah specifically. Well, providers in Utah face some significant challenges. Number one, and I think the biggest one right now, is insufficient funding and personnel shortages. And we're going to talk to Meghan and Curt here in a bit about some of these issues. But what we see is that when we compare Utah to other national statistics, national research suggests that the prevalence of children under age 3 whose development could improve with early intervention services is about 16 to 18%. And that's on average. When we look at populational estimates of disability, it's anywhere between 20 and 25% of the population would have a disability. So of course, 16 to 18% is within that range for young kids. But in Utah, we only serve 3.7% of these eligible children. Part of that's because they're not being referred. Part of that is just capacity. People get frustrated. Anyway, we're serving just a small portion of the children who could benefit from early intervention. The other thing that happens is we're not funding early intervention at a rate that's actually really meeting the needs. Utah funds Part C early intervention at a rate of 1.7 hours of early intervention service per month per child, compared to the national average of 4.7 hours per month per child. Again, placing us very, very low on the list of states who support early intervention. And as a result, this inadequate funding has led to staffing shortages, below market wages, insufficient professional development, reduced service frequency. You can't see kids as often or as much, shorter duration of service visits. And in general, it just creates limitations on what we can provide these young kids with disabilities. So the current Part C crisis in Utah is largely related to a lack of investment. The last time the Utah Department of Health and Human Services and the legislature increased ongoing funding for Utah's Part C early intervention programs was in 2017. That was a bill that was sponsored by Luz Escamilla, right, a senator. It wasn't even funding that DHHS proposed. It was a senator who had to come in and say, I think we should invest in this. Much has changed in the world since 2017. If you think back to 2017, it almost seems like decades ago. And as a result of the changes we've seen in our world as a result of COVID, inflation, increased world tensions. I mean, all the stuff that's going on right now, we're just not receiving the funding necessary to support the kids who are being referred for early intervention services. In fact, many providers are dealing with huge caseloads. These increased caseloads overwhelm staff. It leads to burnout. And in many cases, staff can easily make much, much more money going to work somewhere else at a school district. Unfortunately, some early intervention staff can make more money just going to work at McDonald's or in fast food, because we are not investing in paying these important providers competitive wages in the state of Utah. So with that said, what I want to do is shut up, first of all. And I'm sorry you've had to listen to me up to this point. I'm off my soapbox now. But what I want to do is have a conversation with Curt and Meghan, who have been doing this for many, many years. And I've kind of given them a set of questions that we're going to go through. And we're going to kind of go back and forth, and they're going to provide a picture of what this really looks like. So I'm going to start with Meghan, because I started introductions with Curt. But Meghan, I was wondering if you could share with us a little bit, how long have you been working in early intervention? And from your perspective, why are Part C early intervention services so important?
Okay. Hi. So I have been doing EI for 16 years. So about eight of the years, I was actually a special educator. So I was just doing home visits as a special educator. And then 8 of the years, I've been a program coordinator. So I have about a caseload of 3 to 5 kids. So I still see kids, which is awesome. And then the rest of the time is doing administrative program coordinating work. So the second part of your question, why is Part C intervention services so important? I think I mentioned before that I used to teach. I did middle school and high school in 18 to 21-year-olds as a special educator. And believe it or not, I could tell which kids and families had early intervention. It was very apparent to me back, what was that, 30 years ago now, which of those kids had EI services. The services we provide is so important in terms of getting to the kids and families right in the beginning, when their little brains are plastic and flexible and malleable and getting to work on their development right away. You see such a big difference. But it's also a time when almost like the parents or the caregivers' brains are flexible and malleable and open to the support we can give them and the learning they're willing to take in and the support they're willing to take in at that time of their child's life. So it's just a really good learning opportunity to make a lot of difference, big impact.
Yeah. That's really interesting that you could tell who'd had EI services. I mean, it does really change the way that a family functions, I think. Yeah, and some of the skills. So Curt, what about you? How long? I think you mentioned you've been working 20 plus years, but again, from your perspective, why are Part C early intervention services so important?
Yeah. So yeah, I worked for my first about 20 years as a physical therapist working with little kids with disabilities and developmental delays. And I would echo what Meghan has said. One is that early access to services. We know multiple research studies have shown that in whatever case, whether it's disability or schoolwork or early learning, that early intervention, early identification is critical to being able to allow those children to learn at the fastest pace possible. And then again, like Meghan said, training those parents and helping them to understand. Matt mentioned that with his daughter that they had the early interventionists come in for a little while and they would teach Matt and his partner about the importance of doing these skill sets or these exercises, whatever the case might be. And so that early training and empowerment of those parents to be able to know that they can do it, that they don't have to rely on someone else. And I think that's critical as we look long-term for a lot of these kiddos with disabilities, is that as they go through life, they're going to need some services or they might need some supports, and to empower those parents so that they know that they can help provide those supports, that they don't need to rely on government sources or private sources to be able to help their children, but they can do that. The third thing that I'd say that's critical about the early intervention is just the advocacy. As these children go through early intervention and then into the school district into Part B and into employment and later life, the ability for these parents to advocate for what their children need, to be able to access education, to be able to access environment, to be able to access employment is critical. And that really starts in that early intervention program when these parents come and they're scared and they don't know what to do, and you teach that advocacy that they can advocate for their child and advocate for what that child needs. It's a critical skill. I've seen some of the parents that I've worked with that have become some of the best advocates that I've ever met, not just for their kids, but later in life for other children, and get brought into the early intervention or other disability based programs and really advocate. So the early access, the parent empowerment that they can do what they need to do, and then the advocacy, I think, are the three most important parts of the Part C early intervention.
So, kind of sticking with you, Curt, while we're here, do you have specific examples of children or families who've been directly impacted by Part C?
Absolutely. When you work as long as I have as a provider, you meet a lot of families. Just a week ago, I was in a grocery store and saw a mom, and I walked up there. I said, "Do you remember me?" She says, "Yeah, you're Curt. You're the physical therapist that came and helped my daughter." I said, "Now, how old is she?" She was 22 years old now, and she's entered into employment. But the case that I'd like to share with you about the impact, I remember a little boy that I went in, and he'd had problems with his brain. He'd had a brain bleed on the right side of his brain that was going to impact his ability to move and to utilize that left side of his body. And when I went in there the first time, this mom and dad had another kid who was a couple years older, and they were scared to death, wide-eyed. They didn't know what to do because they started raising this 2-year-old child, but now they had a child with a disability and didn't know what to do. And I remember going in there on that first time and just helping them recognize everything was going to be okay, that we'd make it through, that we'd give them the tools and the resources they need. We taught them about advocacy. We taught them how to work with that child. That child went through the early intervention program and graduated at 3 years old, went into the Part B program, into the preschool, and then into schools. A lot of his school experience was mainstreamed. I would like to think, at least partially, if not largely, due to the early intervention services, that we were able to teach him to crawl and to move and to use a walker and be mobile early on in his life rather than waiting until he's older. Currently, he's graduated from high school. He's currently employed. He can use the public transportation system. And so as we look at that and see the impact of Part C on this family, what a great impact it's had in allowing those parents to be advocates, to know what they needed to do to help that child to be able to access what he wants to access and have a fulfilling life. But on a larger scale, the amount of savings for the state and other programs that might have had to be able to be providing a lot more services for this child as he grew into adulthood. And now he's working at a job that he enjoys. He's riding around on the bus when he needs to, and has got a positive and a happy life that he's living now.
Yeah. Thank you, Curt. So, Meghan, what about you? Do you have specific examples of children or families who've been directly impacted by your early intervention programs? Uh-oh, I think you're muted.
Oh, sorry, I was
There we
muted.
go.
I do have an example of a couple that I actually asked my providers to help me with. One is from a speech language therapist that works for us. She said that she has a child who is about to age out of early intervention, so almost 3 years old. For the sake of the story, we'll call her Annie. She said when she started with her, Annie was 2 years old with no spoken words. There is a family history of her mom not speaking until she was 4 years old. The mom was 4 years old and needing speech therapy until she was a teenager. Additionally, they are very low income and in a single parent home. Due to all these factors, the SLP wanted to start working with her as soon as she heard about the history, the mom's history. The first step was to teach the mom some ASL signs. Annie learned them faster than her mom could, and it helped to decrease her frustration and tantrums since she could communicate her thoughts and feelings. With her able to alleviate her frustration by communicating with signs, the SLP then shifted her focus to teaching Annie to use her voice and imitate sounds. Annie's mom watched intently every visit, and she was coached to use strategies that were helpful during her daily routines, like when Annie asked for food during bath time, and then they played together in the afternoons. The SLP just did her annual testing, and Annie is able to graduate early from our program because of her amazing progress she has made thanks to our coaching and her mom's work with her. She has overcome the odds that she would have a similar outcome to her mom and likely won't need speech therapy in the future. As of yesterday, she is speaking in 5-word sentences, asking questions, and is a vibrant social communicative child. So she's actually going to exit out of the program before she's 3. So that's exciting.
That's amazing. That's amazing. And it's amazing. You bring up a really good point there. A lot of parents struggle with behaviors and even teachers struggle with behaviors. And yet a lot of those behaviors are related to the ability to communicate. And if we can help kids communicate earlier on, it addresses a lot of these other issues that are concerns farther on down the road.
Mm-hmm.
Yeah. So did you say you had another example?
I do.
Awesome.
And the other one I have, and this one's a little different, so this is a good one too. This is from one of our physical therapists, our PTs. Little Zach came to me before his first birthday. Both he and his twin sister were struggling with development. Zach was significantly delayed as compared to his sister. We, the family and I, decided to give his development a period of time before looking for answers. It wasn't good. He was initially determined to have cerebral palsy. We worked hard. We knew that if he could independently sit by a certain age, that he would walk by a certain age, thus improving his chances for the best outcome in motor development. We worked through Botox injections. Then came the devastating news. He has a progressive leukodystrophy. His diagnosis is Aicardi-Goutieres syndrome, and I'm sure I butchered that. Sorry, everybody. Life expectancy is only 10 years. It's rare, and I have never heard of it, this physical therapist. This physical therapist attended a virtual conference with mom on the syndrome. The monthly medicine to help slow the progression of the syndrome is $20,000. PIP, which is parent-infant program through the Utah School of the Deaf and Blind, joined the team because of the correlation with the diagnosis. A speech language therapist joined for a while to offer input on swallowing and speech. And the parents then wrote, the mom and the dad both wrote a thank you note to this physical therapist about the huge imprint that she had left on their life. And they left a huge one on her. He and his family will always hold a special place in her heart. And she had actually taken a picture of the very nice individual thank you notes that the mom and the dad wrote to this physical therapist, which is very, very unique. Usually the moms write a really quick note if you get anything at all, but actually the mom and the dad wrote the note. So.
That's awesome. And I mean, these are just a couple of examples from thousands and thousands of kids who are impacted every year. When I go out in the community here and I meet people and I talk to people and I tell them where I work, although we have many programs here at the Institute, the one that I hear about mostly, and it's inevitable every month I meet a parent or a grandparent or somebody who just waxes incredibly eloquent about early intervention and our up to 3 program, or our Southeast Early Intervention program, and just the impact that early intervention had on their family. I had a dental hygienist the other day who I was in the chair trying to getting my teeth cleaned, and I told her where I worked, and she started talking about how her son went through early intervention, and she's crying while she's cleaning my teeth. It made me very nervous. but it's just incredible the impact that these programs can have on families and individuals. So thank you, Curt and Meghan, for sharing those stories. So now let's shift here. So it has an impact. It's important. It's helping these kids. What are some of the specific challenges that you're facing as Part C early intervention providers here in Utah? And I'll start with you, Meghan, and then what's been your biggest challenge since COVID?
Gosh. Yeah, where to start, right?
Yeah.
Challenges would be funding, I think, right now. And I guess you could put that with in general and since COVID. Um, Funding has been a hard part always, but it really has been a challenge since COVID. We have continually been understaffed, had positions open, fighting to figure out how to work through that and how to be creative and getting those positions filled or yeah, mostly filled. But you know, we just can't, it's really hard to be competitive and have competitive wages. Or even if we have really, really good benefits, like we have great benefits, medical, what we can do with retirement and and our leave and all of that is super great, but it's just not enough. It's just not enough in this day and age. Um, COVID has changed so many different things. People are different now. COVID really socially and emotionally changed people, and what they're looking for is just something different. And I think that is true for the people you hire, and it's also different for the people you see. And so, in order to fill positions with people who can handle what we're asking them to do, there has to be you have to be a certain kind of person. So you have to be a PT, but you also have to be handle what you're walking into. You're asking a lot of people when you're doing home visits. Like you have to be an understanding person. You have to be able to have that little bit of social emotional training in you, which we do a lot of. And it's a very important piece, but we're not social workers by nature or by training. And so that's a big thing. A lot of our families are just trying to get their basic needs met, right? So we talked about the COLA earlier. The cost of living in Salt Lake and all through Utah has skyrocketed. It is not normal. We are not living in normal, like what we're used to. And so for our employees and for the people we see, they're living in unprecedented times. And so a lot of times we go into visits, and the families are just struggling to make ends meet. So we might have to go in and work with a family that we have to talk about how are they going to get food? How are they going to, do we have any resources? What's going to happen? Things like that. And the same goes for our employees. They come into work extremely stressed because we can't provide competitive wages. And so sometimes they need to leave. So sometimes we are not able to provide a sustained employment for certain positions. So some people are really loyal. We are lucky that we do have a loyal staff, but it's understandable if they have to go somewhere else to make ends meet. And then Medicaid has been they're making, going through all of their clients and making sure everyone's eligible and upping their files and making sure who's still eligible, who is not eligible. And that has affected all of the EI programs greatly because many who had been eligible through COVID as the requirements had been dropped during COVID are no longer eligible. So those of us who had leaned on having that Medicaid money no longer have that Medicaid. Who had those kids that were on Medicaid no longer have that. And so we even have decreased billing through Medicaid now.
Yeah.
So there's a lot of things.
There's a
happening.
lot. There's a lot. And that Medicaid expansion was huge for early intervention providers because more people qualified.
It was gigantic.
Yeah. Yep.
So yeah.
Incredibly helpful. So Curt, why don't we go to you? And you probably have some overlap with what Meghan said, but what are some of the challenges that we're facing in our EI programs? And then what's been the biggest challenge since COVID?
Sure. And just to kind of tag on to what Meghan said about the Medicaid dollars and the funding through Medicaid, one of the things that we struggle with is that when those kids are no longer eligible for Medicaid, they shift over and are paid for by the state contract. the state contract that we get each year is determined before the beginning of the fiscal year at July 1. And so as these kids started losing their Medicaid, they became paid for by the state contract, but the state contract didn't increase. So we're just currently, all these kids that shifted from Medicaid to the state because they don't qualify for Medicaid are now being seen basically pro bono because the state contract didn't increase when these kids came off of Medicaid. And so we're getting fewer kids on Medicaid and more kids on the state contract, but the state contract hasn't changed. So that's one of the things that's really difficult, is that the state contract can't change during the course of the year. But if kids come off Medicaid, or if the percentages between Medicaid eligible kids and state eligible kids changes, then we end up just seeing those kids essentially for free because we don't get any additional state dollars. So I just clarify that on that Medicaid. It's not just that we're getting less Medicaid. We still have to see the kids, but they're on theoretically on the state dollars.
Yes, thanks, Curt.
You bet. The other thing I think that's important to point out is that with the Baby Watch Early Intervention Part C program in Utah, one of our requirements as providers is that all providers have to be bachelor prepared or higher. We can't hire paraprofessionals. We can't hire associate degree professionals. Everyone has to be bachelor prepared. And as I looked at one of the concerns, as Meghan talked about recruitment and retention, here in Cache Valley, a first year straight out of school as a special education graduate makes $20,000 more going to the school district than they do coming to work for us for early intervention, because that's what we can afford to pay. And so we get a lot of folks that'll come maybe for a year and then leave because they can make more money in the school district or make more money elsewhere. With the DOPL license, Department of Professional Licensing organization here in Utah, a lot of our professionals are DOPL licensed. So physical therapists, occupational therapists, speech pathologists, nutritionists. It's hard enough to find DOPL prepared professionals if you're paying at the going rate. And when you say, well, we'll pay you $10,000 or $20,000 less than you could get in private practice or in the hospitals or in the clinics or school districts, it's really tough to find people. I'll shout out to our providers as well. Like Meghan said, thankfully, we've got people who are in it for the job, for the benefit of helping people rather than the money, or we would not have providers, because I guarantee you just about every provider in the early intervention up here in northern Utah, the Part C, is underpaid compared with state and national averages. Those one of the big things that's difficult, and it's what's on my mind always, is we have to walk the line between affordable practice, what we can actually provide based on the funding we have, and best practice. And we've always tried to be best practice. We've always tried to provide what the kid needs and the family needs to be able to maximize their potential, to be able to make their lives what they want their lives to be. And just this morning, I had a conversation with our program director about, okay, where do we make cuts? Where do we have to make changes? And what parts of the early intervention program do we have to shift from maybe best practice to affordable practice? And that's an ongoing struggle because, like I say, being here almost 25 years, I've watched this go from really best practice, more services, to kind of meeting the requirements, but sometimes not being able to apply best practice. So both before and after COVID, that's been a struggle. And I would agree wholeheartedly with Meghan as far as the post-COVID. It's about that social emotional. It's about having to do more with less and having to try to help those families recognize the value of what we're doing when we can't be as supportive as we might have been prior to COVID.
Yeah. One of the really scary things that you point out is that, let's say, a bachelor prepared special ed teacher can make $20,000 more going to work for the school district. And we know that special educators are not highly paid in the school. So
right.
That's how big the disparity is between early intervention and public education funding. So with that said, and as we're getting to the end here, we'll stay with you, Curt, since you were going. How can the state of Utah better support Part C early intervention providers?
I think about this, and I hate to just say funding because everybody comes saying funding. Yeah. But really, I think a couple of what would seem fairly easy to me, to have something built in as just a standard cost of living adjustment. Currently, we haven't had a cost of living adjustment that's been funded, ongoing funding, since 2017, as Matt noted earlier. Some of us still we've tried to give cost of living increases, but that has gone back to that affordable versus best practice. And what are we going to cut so that we can give a cost of living. So that kind of built in every year a cost of living increase would be one way that it would help. The other thing that I thought of would be to be able to roll over funds. A lot of times we come to the end of the year, and one of the concerns of the legislature and the funding sources is that we aren't able to spend all of our contract down. That's largely because people leave and nobody fills the position for 2 months because nobody wants to work for what we have. So we have this chunk of money that was in the budget to pay that person. Well, that person left and we didn't replace for a little while. So we have this chunk of money. And then at the end of the year, we have this chunk of money that we've got to spend down. Otherwise, it looks like we don't need more funding because we had money left over. And so to be able to roll that money over, if there was a way to do that, I think that would be a pretty easy thing to do, to roll that funding into the next year so that we could continue using the funding in maybe a wiser way rather than just trying to spend it down for the sake of spending.
And that proposal doesn't require a new infusion of dollars necessarily, right? It just allows you to carry forward what you've already got. So Megan, what about you? What are your thoughts on how the state of Utah can better support early intervention?
Those are two of the things I was thinking about. Also a better branding of early intervention with Baby Watch, and how, so we're not, because early intervention, as I think you had said in the beginning of the presentation, early intervention could be early intervention of a lot of things. So it could be early intervention for rehabilitation patients, or alcohol or drug, or, and so we're kind of all hooked together in some way, but then it's all through Baby Watch. So we're all linked together, and then people know how to find us. So we're more of your baby kind of thing. And also I was thinking, is there a way we can create through the Department of Health and Human Services, like a way that all of these early childhood programs are defined, and so duplication of services we're all working together under the same umbrella, so there's no duplication of services. So there isn't so much confusion. So we're all using each other for our strengths of our services instead of overlapping so much.
Yeah.
And so it wouldn't really help the funding, but in a way, it would just be better efficiency and efficacy, maybe.
Yep.
So maybe that would help a little bit we would kind of be where we are too.
Yeah. Well, and that's one of the requirements of the program, is really, right, to create that interdisciplinary cross-program collaboration. And, that it requires somebody who's intentional and, wants to help facilitate that. It just doesn't happen naturally, unfortunately.
Yeah. How do we not get lost in the weeds?
Yep. Absolutely.
I don't know.
Yeah. Well, thank you, Curt and Megan. I appreciate you sharing your experience and your insights. I'm going to move on here towards the end because we're almost at our time, but we will hang on here for a bit for questions if folks want to ask questions. But I just want to close by reiterating some of what's been talked about, and just really highlight that investing in IDEA Part C, early intervention, is not just about supporting children with disabilities. It's about investing in the future of our communities. It builds stronger families. It builds better schools. It creates better professionals, right? And so early intervention touches many aspects of these social service systems. And by providing every child with the tools and resources they need to succeed, we're actually helping to create a stronger, more equitable and inclusive society for all, which I think, I hope that's what we're all working towards. Now, when we look here in Utah, what needs to happen to help Utah kids? Well, I think, and again, as Curt said, funding is not always the answer. And yet, given some of the economic constraints that have arisen, especially since COVID and the massive inflation, there is a need to increase funding for Baby Watch early intervention. That's all there is to it. The fact that a special ed teacher, can make $20,000 more in the school district than working in early intervention for doing a very similar job is depressing, to say the least. And so it's important that the state legislature and the Department of Health and Human Services find ways to increase funding for Baby Watch, whether that's allowing carry forward of last year's money or in creating cost of living increases or whatever the case may be, there has to be a better strategy. Number two, I think the state needs to invest in staffing. We've got to start investing in recruiting and retaining qualified early intervention professionals. And that starts by supporting pre-service programs and mentoring programs and really helping people recognize that early intervention is a viable career choice where they can make a huge difference. And again, you can invest in that staffing many ways, but one of the ways would be to create an annual cost of living increase that would incentivize people to stay within the early intervention programs on a year-to-year basis. Finally, and again, this has been a common theme, strengthen family engagement. Early intervention does a great job at family engagement, and yet I think we can do better. As Meghan brought up, there's other resources, there's other agencies, there's other programs that we could collaborate with. And if we can find better ways to connect families to services and supports in their communities, the outcomes for their kids are going to be better in the long run. So anyway, with that said, we're right at 1 o'clock and it's time for questions. So I know that some of you may need to run, and that's fine. I'm happy to hang on for a bit here and answer any question, but I do want to thank everybody for tuning in and for participating, and hopefully you learned something. We will send out the recording of this as soon as we're done, and we would encourage you to share it with your legislators, share it with your community, with your staff, and really let's try to get the word out about the importance of supporting early intervention here in Utah. So with that said, any questions? I'm going to stop sharing. We were that clear? Wow. It's not a complicated request, I don't think.
I actually have a question, if that's okay.
Yeah, absolutely.
I am a behavior analyst for specifically kids with autism is who I work with. And I was curious just how many, like the statistics you shared in terms of kids who receive early intervention services don't end up needing, or at a lower rate, don't end up needing subsequent services in the public school system. Do you know how true that is for kids with like lifelong disability, like in terms of autism diagnosis, where like that doesn't go away? Does that question make sense?
Yeah, so yeah, you're right. So yeah, there's going to be kids who are born with like what cerebral palsy, autism, things like that. They aren't going to go away. I don't know the specific statistics off the top of my head, what that looks like in the long run. I think I could go back to the example that Curt, and Meghan brought it up too. You can tell the families who have been through early intervention. So although it doesn't get rid of the disability, it does provide the family and the individual with some of the skills they need to be more successful and to be more effective advocates. But I will go and look and see if I can find statistics on that, Aubrey. If you drop your email in the chat or in the Q&A, I'll see if I can find something specific to answer your question.
I really appreciate that. Thank you so much.
Yeah, you bet. Thank you. And I don't know, Curt or Meghan, did you want to try to answer that? No.
I think you hit the nail on the head, Matt. It's the advocacy and it's the training of the parents that,
Mhm.
you know, they may not need as many professional services because those parents may have developed a skill set where they are able to interact with their child in a more meaningful way, whether it's autism or cerebral palsy or whatever, any of these lifelong challenges. So I think you hit it on the head.
Yep.
Okay, thank you. Any other questions?
Matt, in our Q&A box, we have a question from an anonymous participant. At the beginning of the presentation, you were going over some policy related to IDEA Part C, and they would like to know what word was used when talking about intent, providing children with need to achieve. And I'm so sorry, I wish I had better context. I was doing some background facilitation needs. If the person who asked that question is still on, please feel free to clarify if you're here.
I'm trying to figure out like the intent of the program with what need to, I'm trying to make sense of that with looking back on some of these slides. I'm not sure that I totally understand that intent. Provide children with what they need to achieve blank. I guess maybe. I mean, it's the need to achieve the most effective developmental outcomes in their individual lives. We can't say that every child's going to overcome their disability, and yet I think the intent of early intervention is to help every child achieve to the best of their ability by giving them and their family the tools that they need to do so. So that's my rough interpretation and answer. I don't know if that's, but if somebody wants to clarify, great, or you can shoot me an email, and I'm happy to answer that. My email, I can put my email in the chat if folks want to shoot me one there and remain anonymous. But my email is wappett@usu.edu. There it is. Oh, not Wappett. Sorry, that's it. Made it possessive. Why? Oh, I hate autocorrect. So there it is. Sorry, it's below. Okay. Well, if there's no other questions, just like to say thank you to Curt and Meghan for sharing their experience today. Thank you to all of you here who are early intervention providers. You do make a difference, and what you do is incredibly important. And just know that you have our support here at the Institute for Disability Research Policy and Practice to advocate for the additional resources you need to do your jobs effectively. So thank you.
Thank you, Matt.